Thank you so much, Minister Allen. Good morning, everyone. Yes, I am a real nurse. I studied very hard for this license, this degree. So thank you so much. God bless you, everyone. So today I am going to continue with our topic from last week, which is on kidney stones. As I load up my screen, I'm just going to touch a little bit on some of the things we already spoke about last week. And then we'll get started. So some of the symptoms of kidney stones, these are little stones, these little pebbles you see here, passes through the urethra and the ureter. And yes, it is painful. Some of the symptoms may be fever, stomach pain, vomiting, you may get dizzy, blood in the urine, and backache. This is what some of the stones look like. So there's different forms of stone. You have the calcium stones, the uric acid stone, the stuvite stones, and the cystine stones. So let's get into it today. So diagnosing kidney stones. Diagnosis of kidney starts with a medical history, physical examination, and imaging test. Your doctors will want the exact size, shape, and of that kidney stone. So that's why they're going to go through all of that. This can be done with a high resolution CT scan from the kidneys down to the bladder, or an X-ray called a cup X-ray, kidney or bladder X-ray, which will show the size of the stone position. The cup X-ray is obtained by the surgeons to determine if the stone is suitable for shockwave treatment. The cup test may be used to monitor your stone before and after treatment, but the CT scan is usually preferred for diagnosis. In some people, doctors will also order an intravenous pyelogram, or IVP, a special type of X-ray of the urinary system that is taken after injecting a dye. Second, doctors will decide how to treat your stone. The health of your kidney will be evaluated by blood tests and urine tests. Your overall health and the size and location of your stone will be considered. Later, your doctor will want to find the cause of the stone. The stone will be analyzed after it comes out of your body, and your doctor will test your blood for calcium, phosphorus, and uric acid. The doctor may also ask that you collect your urine for 24 hours to test for calcium and uric acid. So let's get into the treatment. The treatment for kidney stones is similar in children as well as in adults. And yes, as you remember, I touched on that children can also get these. You may be asked to drink a lot of water. Just try to let the stone pass without surgery. Surgery is not always the first option. They try to get it out as much as possible by you drinking a lot of fluid. You may also get medication to help make your urine less acidic. But if it's too large, if the stone is too large, or if it blocks the flow of urine, or if there's a sign of infection, it is removed with surgery. So shockwave lithotripsy is a non-invasive procedure that uses a high energy sound wave to blast the stone into fragments that are then more easily passed out in the urine. So they'll shock it and you just have to pass it out. Then you have what's called the uteroscopy, kidney stones ready to extend. An endoscope is inserted through the ureter to retrieve or obliterate the stone. If kidney stones are left untreated, it can result in UTIs, kidney infection, or loss of kidney function. So this is important for you to follow if you're having any of these symptoms that I discussed earlier. So let's say you have the endoscopic surgery. This is one way to stent incision, but the area is very sensitive. You have pain in your urination, urinary frequency. You will see blood in the urine off and on until the uterine stent is removed. The urine turns red. You want to limit your activities and drink plenty of fluids, as I discussed. It is normal to experience what's called bladder spasms, flank pains, and blood in urine while the stent is still inside of you. Again, drink plenty of fluids so it is draining properly. If there's a string on your stent, you don't want to pull that out. Please don't do that until the specified date. The doctor will tell you when and how you'll do it. Yes, you may have to pull it yourself. If you get scared doing it, then you have to call your physician or the nurses to help you to take that out. Your physical activities should be restricted, especially during the first weeks of recovery. And during this time, I want to use the following guidelines. And with any surgery that you have, be mindful guidelines you should be taking afterwards, because it can make things bad for yourself, or in the worst, surgery. So you want to do no heavy lifting, anything greater than 10 pounds for about 4 weeks or so. no driving, and you want to limit long car rides for about approximately 2 weeks. You want to do no strenuous exercises, limit stair climbing to a minimum about 4 weeks. No severe straining during bowel movements. It's important that you're not straining even on an everyday basis. Number one, you could vasovagal, and you can also cause other things to happen where you start to increase your bleeding. So if it's necessary, the doctor may give you a mild laxative that you may have to take. And drink plenty of fluids to keep the urine flow brisk. Dribbling and poor control is normal for the first several weeks while you're healing. And if you start having fevers, especially over 1 or 1.5 or higher, you want to get to the emergency room and get yourself checked or make sure the doctor is aware. If you're seeing a lot of heavy bleeding or blood clots, or you're unable to urinate, you want to make sure that the doctor is aware as well right away. So how can one prevent kidney stones? Drinking enough fluid will help keep your urine less concentrated with waste products. Darker urine is more concentrated, so your urine should appear very light yellow to clear if you're well hydrated. Most of the fluid you drink should be water, but not just plain water. I had an incident with a patient that drank a lot of water and it's knocked the sodium out. So remember that I spoke about a while back, even when you watch football players, there's a reason why they don't give them just water. They give them Gatorade and water to replenish any electrolyte that you may lose drinking just water, because that will pull a lot of electrolytes as mindful of that. And a lot of people have actually drinking too much water, so just be careful of that. Most people should drink more than about 12 glasses a day. Speak to your healthcare professional about the right amount of water that's best for you, because we all have different amounts that we can and should be drinking. Me, I'm supposed to drink a gallon a day. Nurses, sometimes that doesn't happen. Water is better than soda, drink, or coffee and tea. Or if it's hot outside, you should drink more. Sugar and high fructose corn syrup should be limited to small quantities. Eat more fruits and vegetables, which make the urine less acidic. When the urine is less acidic, then stones may be less able to form. Animal protein produces urine that has more acid, which can then increase your risk of kidney stones. You can reduce excess salt in your diet. What foods are high in salt? Everyone thinks of salty potato chips and French fries. Those should be rarely eaten, but there are other products that are salty, like your sandwich meats, your canned soups, your packaged meals, and even sports drinks. So you want to read the content, you learn how to read labels of what you're purchasing yourself as well as for your children. You want to try to get a normal weight if you are overweight. But high protein weight loss diets that include high amounts of animal protein, as well as a crash diet, can add the risk of stone formation. So when do you see the doctor? You want to make an appointment with your doctor if you have these words. Pain or find a comfortable position. Pain accompanied by nausea, vomiting. Pain accompanied by fever and chill. Blood in your difficulty passing urine. Note, stone chronic kidney disease. So if you have had one stone, you are also at risk for having another stone. Those who have developed one stone are at approximately 50% risk for developing another within another 5 to 7 years. So you want to be mindful of the things that you're going to be doing now. Remember, kidney stone, also called renal calculi, nephrolithiasis, or urolithiasis, you'll hear these words, are hard deposits made of minerals and salts that form inside your kidneys. Diet, excess body weight, some medical conditions and certain supplements and medications are among the many causes of kidney stones. Kidney stones can affect any part of your urinary tract, from your kidneys to your bladder. Often stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful. I repeat that. It can be quite painful. I've heard women say it's more painful than having childbirth. It's painful. So imagine what men go through when they have to pass this. It is extremely painful. But the stones usually cause no permanent damage if they are recognized in a timely fashion. Depending on your situation, you may need nothing more than take pain medication and drink lots of water to pass a kidney stone. In other instances, for example, if stones become large in the urinary tract or associated with a urinary infection or cause complications, surgery may be needed. If you don't get scared, you have to have it done. Now, remember, this March is National Kidney Month. So just make sure that we're taking care of those little nuggets. They are very important to us, and it's important that we take good care of them. I want to give special acknowledgement to the Kidney Fund, to kidneyfund.org, the National Kidney Foundation, Urology Care Foundation, and the Mayo Clinic, the information that I provided you these last 2 weeks. I hope this was helpful. Should you have any questions, because you're on a prayer marathon, feel free to log into a YouTube page and you can put those questions there, and I'll be happy to answer them for you. God bless and enjoy the rest of the service.